So thank you again for inviting me to talk to everyone today. The topic of my presentation is nasal congestion. So nasal congestion is something that almost everyone experiences in their life or at some time in their life. But many people don't know about the possible treatment options for treating nasal congestion. And it's the most common complaint that I see in my clinic. And there have actually been a lot of several new treatment options that have been introduced in the last couple of years that can help someone like you or someone that you know. And so that's what I want to talk about today. So before I get into the treatment options, I want to just briefly go over how does air flow through your nose. And so if you look at this picture here, the one on the side to the left, we see a side view of the nose. And we see that air enters into the front of your nose and travels past a few structures inside your nose before it enters the top of your throat, which is right here. Once it enters your throat, it goes down into your lungs. And so when air flows through your nose, it passes two structures. The main one is the middle turbinate here and the inferior turbinate. These are like sausage-like structures that sort of come off the side of your nose. If you look at this picture here, this is a front view of what your nose looks like in the inside. We see that there's things that sort of stick out from the side of your nose inside. These two middle turbinate and the inferior turbinate. So when you breathe air through your nose, air passes past these things into your throat. And these things help humidify and also filter any particles in the air. But when these things become diseased, if they are sick, then they can swell up. And when they swell up, like in the picture here on the side, you see that the space where air usually flows through becomes very narrow. When it becomes narrow, that's how you develop symptoms of nasal congestion, because you're trying to push air through a smaller space through your nose. But there's actually a lot of causes of nasal congestion. And so the way I think about nasal congestion is you can split it into two categories in terms of what can cause nasal congestion. The first, I consider an anatomical obstruction. And that's when something that's not supposed to be inside your nose is there. It's blocking the air from passing through. And so in those cases, I consider that an anatomical obstruction. The second category is swelling of the lining, which means that the inside of your nose is normal, but something has happened to it so that it becomes very swollen on the inside. When it becomes swollen on the inside, air has more difficulty passing through your nose and getting into your throat. And so one of the first things I try to figure out when I see a patient is it an anatomical obstruction, or is it swelling, or is it both, right? And swelling can be caused by many different things. It can be caused by allergies, infection, inflammation, or several other causes too. And so if you look at the pictures here on this slide, if you look at this picture on the left here, this is a normal nose here. And we see that the middle of their nose is pretty straight, and the structures on the side of their nose are very small. And when your nose is like this, you can see that there's a lot of space for air to pass through, okay? And if you look at this picture on the right here, this is a picture of a nose that has some problems. So if you look at the wall in the middle of their nose, you see that it's really shifted to one side. And when it's shifted to one side, this side of the nose becomes very narrow. And when it's very narrow like that, patients will have trouble breathing through that side, and they'll complain about, oh, that side of my nose is much more stuffy than the other side. But if you look on the other side of this nose, you see that the structure on the side of this inferior turbinate is very swollen. And so this person has two problems. They have the anatomical obstruction, and they have a swelling of the nose here. And so this swelling also causes a decrease in the amount of room for air to pass through inside your nose. And so this patient will also complain about congestion on this side as well. And so as you can see, congestion can be due to multiple things, and it can cause congestion on both sides. The reason that you have congestion on both sides could be different reasons for both sides. Another possible cause of nasal congestion is there's an issue with the roof of your nose. So most people, your nose looks like this, and your nose is held up by this cartilage that forms the shape of your nose. But some people, when their cartilage is sort of weak, so when they breathe in, the roof of their nose actually collapses a little bit. And so when that's the case, this collapse causes the opening of your nose to shrink in size. When the opening of your nose shrinks in size, it's harder for air to pass through your nose. So this is another possible cause of nasal congestion, is when the roof of your nose that's supported by this cartilage is weak. Another cause of nasal congestion is infection. So if you get a sinus infection or you have a nose infection, it causes the insides of your nose here become very swollen. And when the inside of your nose becomes very swollen, then the amount of space for air to pass through becomes very narrow. And that's how people develop nasal congestion when they have infection, because the space that they're used to breathing through becomes much smaller because of the infection. And so that's how they develop those symptoms of nasal congestion. And one other cause that you might hear about is nasal polyps. So nasal polyps are these little grape-like soft things that sort of grow off inside your nose. They're more common in people with asthma or who have allergies to aspirin. And what happens is these grow down from the ceiling of your nose and they can block where your air usually passes inside your nose. So if you look at this picture here, this is the side of your nose, the inferior turbinate. This is normal. This is the middle of your nose, your septum, which is normal. But you see there's things in the middle here. There's one here and one here that's marked by a star. And these things are blocking the passageway where your air usually passes through. So that's how a patient like this will also have nasal congestion, because there's something blocking where the air should be traveling through. And so there's so many causes of nasal congestion. How does your doctor determine what's causing your problem, right? And so there's three things that every physician should try to do to try to figure out, what is the exact cause of your nasal congestion. The first is a very good history. History means that we ask you questions about what side is worse in terms of breathing, how long has it been going for, has it been getting worse over the last couple of months, have you tried any medications, has anything helped with your breathing problem? And then based on that, we do a physical exam. A physical exam is like what we see here in this picture. We look on the outside of the nose to see if that wall of the roof of the nose is moving at all. We look at the opening of the nose, see how open it is. Is there anything blocking the opening of the nose? And then the last part, the third thing that I usually do actually is a nasal endoscopy. This is a small procedure that we do in the office where we put a camera inside the nose to see exactly where inside the nose is it blocked. And so I have an example on the following slide here. So if you look at this video here, so you have a doctor spraying some numbing medication in first. This usually takes about a minute to work. And after we spray in the numbing medication, I use a very thin camera. It's about two and a half millimeters wide. We look inside the nose. So we're looking on the right side of this patient's nose. We go in and we try to see if there's anywhere that's being blocked. And so we follow this passageway here, which is where air travels to through your nose. So that's the inferior turbinate here, your septum is here. As we get towards the back here, we get to the top of the throat, which is right here, right? And so in this patient, she has a normal exam, but what I'm looking for when I look in this in people's noses is to see where is it blocked. Sometimes you'll see a polyp here, you'll see that septum is deviated, you'll see that this side of the wall is more swollen, and that gives us very good information as to what is exactly causing your symptoms. So right now he's looking a little higher up. This is a space here inside the nose where polyps usually grow. And this patient does not have it, but if the patient had polyps, it would grow in this area here. Now he's looking on the other side. So this is a very, I think, important tool, especially for ear, nose, throat doctors, to really determine what is it that's causing the nasal congestion inside your nose. I can look on the outside, I can get your history, but to be able to look directly inside the nose provides a lot of valuable information as to what is it exactly that's causing your symptoms. And so once we gather this information, what do we do? And so we take this information, we take the questions that we asked you and what how you answer them. We take the information in terms of what we see from outside of your nose, and then we take the information of what we see inside your nose, and we put that all together. And we put it all together and we try to determine, what is it that's causing your problems. And so if it's an infection, if we look inside your nose and we see pus, we see swelling, and it's very painful, then usually it's a sign of infection. And for infection, the first line of treatment is antibiotics. Antibiotics are pills that you take, usually take them for about 2 weeks. If your symptoms do not get better in 2 weeks, then usually we have to move on to surgery if you're still having symptoms, or you get another course of antibiotics. If the cause of your nasal congestion is swelling, then usually we try nasal sprays first or oral medications like pills. If those don't help improve your symptoms, then the options are you can do a small office procedure, which I'll talk about later, or we can do surgery, okay? But if the cause of your obstruction inside your nose is because something is physically blocking there, like a polyp or something, a mass or a deviated septum, then usually medications are not going to work because there is something there that has to be removed. And so usually those cases, surgery is the only option to improve your symptoms. But I want to talk a little about just the common medications that we usually give for nasal congestion. So nasal sprays are the most common. I tend to think of nasal sprays in two categories. The first is over-the-counter nasal sprays. These are the ones that you commonly see at the drugstore, at Target, et cetera. And the second kind are prescription nasal sprays. These are ones that your doctor has to write a prescription for you in order to get these nasal sprays, okay? And then there's also oral medications. Oral medications really depend on what is the cause of your nasal congestion. And based on that cause, there's certain pills that you can take to probably improve your symptoms. So first, we're gonna go over the most common nasal spray that you see that most people will talk about is steroid nasal sprays. These are Flonase, Nasonex. These are things you can buy at any pharmacy without having a doctor's prescription. The key for these type of nasal sprays is you have to use them for about 6 weeks every day to see the maximum benefit from these sprays. A lot of times patients will come to me and say, tried it for a week, and then they didn't think it worked, and so they stopped using it. But the key for steroid nasal sprays is you have to use it for at least 4 to 6 weeks to really know if it works or not for you, okay? The second type of nasal spray that a lot of people will use for nasal congestion are decongestants. These are things like Afrin or other types of nasal sprays that are decongestants. You have to be careful with these sprays because these sprays, you can't use it for more than 3 days in a row. You can't use it for more than 3 days in a row because they have a rebound effect. So after you use it for more than 3 days, you actually get more congested afterwards. And patients can sometimes get addicted to these medications because they get a little bit of benefit when they use it, and then it becomes worse again. And that's because they're probably using it too much. And so you never want to use these medications, decongestants, more than 3 days. So moving on to other types of nasal sprays that I consider for my patients with nasal congestion are prescription nasal sprays. And so there's two types that I tend to prescribe. The first is an antihistamine called azolastine. This is a spray that's generally better for patients who have nasal congestion that have allergies. They're allergic to pollen, they're allergic to trees, they have a positive allergy test. That's where this nasal spray has the best effect, is for those patients. The side effect of this nasal spray is that sometimes it tastes sort of bitter, and so that's why some patients don't tolerate it. But otherwise, it's a pretty good spray for patients with allergies. The second nasal spray I tend to prescribe is ipratropium. This is an anticholinergic, so this spray is better for patients who have nasal congestion as well as a runny nose. And so it works really well for drying out patients who have a runny nose. Sometimes it dries out too much, and so if it dries out too much, then you tend to use it less. And so usually it's prescribed for 3 times a day, but if it gets too dry, then I have patients use it only once a day. And in terms of like medications, so if a patient is determined to have an infection inside their nose that's causing a nasal congestion, the antibiotics are the first line treatment. And the most common antibiotic that I give for sinus infections is called Augmentin. It's a type of penicillin. And usually you take a 14-day course to see if you get better. If you don't get better after 14 days, the other options are to try another antibiotic course, or you need surgery to help improve the infection. Steroids are a very common medication given for nasal congestion, and that's usually given for patients that have swelling inside their nose. So if you have swelling, I tend to give like a 2-week course of prednisone or a measurable dose pack, and that usually helps alleviate the symptoms. But steroids are medications that you can't take for too long because they have side effects for your body. And so if a patient is requiring multiple steroid courses, like they need one every month or one every couple of months, then we have to start thinking about, should we do surgery to help improve the symptoms? Because when you take steroids that much, you can cause a lot of bad side effects for your body. So yeah, so if you've done the nasal sprays, you've done, take some medications, but you're still not getting better, you still feel like you're stuffy inside your nose, the next step is to think about what type of procedure might be beneficial to help you improve your symptoms. And office procedures are very more recent techniques that have been introduced to our field in the last, I'd say, 10 years or so. And the advantage of these, and they're very popular among patients, are because they can be done right in the clinic. You don't have to go to the operating room. You don't have to be put to sleep. And what happens is the doctor gives you a little bit of numbing medication at the beginning. and then they can do the procedure in about 5 to 10 minutes, and then you go home right afterwards. And you don't, it's very easy and quick, and so it's also very well tolerated. And so there's four techniques that have been introduced in the last couple of years that I want to introduce you guys to. And it's important to remember that these are meant for specific types of patients, okay? And so I'll go over each of them in the following slides. So the first one I want to talk about is called Clarifix. Clarifix is a procedure that's beneficial for patients that have nasal congestion as well as a runny nose, okay? And usually patients that have tried the ipratropium nasal spray, that was one of the prescription nasal sprays I mentioned earlier, if they have benefit with that nasal spray, but it's not enough, or they have to use that spray a lot, then this procedure can help reduce the need for that nasal spray and also improve their their runny nose, their nasal congestion as well, okay? So what it involves is we use this device here. This is something that we hold, with your right hand here, and you want to place the length of this tube, the end of this, into the nose at the very back. So you want to go into the nose and place the very back. And what it uses a lot of a cold technology, it's called a cryofuel. So it's like a liquid that's very cold to freeze the nerve here that contributes to nasal congestion as well as a runny nose. And so this canister here contains that liquid, that freezing liquid inside here. And when you turn it on, the liquid goes into here and fills this little bulb here, okay? So if you look at this video here, basically what it involves is you place this end of this into the nose until it hits this area in the very back of the nose. And you leave it there for about 30 seconds and then you take it out. And then the patient in about a couple of days will have a decreased runny nose and decreased nasal congestion. So this is a picture inside the nose here. They put some numbing medication on that cotton there. And what they want to do is they'll place this end of the device at the very back. This is where the nerve comes out. That's responsible for runny noses and nasal congestion. So he's putting the device here. So that's the tip of this device here. You see it's pressing against the nerve comes out, and it's going to fill with that freezing liquid. Now it's coming on. It's freezing this area here. When it's freezing this area, it's basically freezing the nerve here. When it freezes the nerve here, the nerve is less active. When it's less active, then you'll have less runny nose, and you have less swelling inside this nose, okay? The second procedure I want to talk to you guys about is called Latera. So this device is an implant. It's a very small implant that you put underneath the skin of your nose to help hold it up. And these are for patients that have nasal congestion because the roof of their nose is a little floppy, okay? And so basically you place it on top of between the bone of your nose and the skin of your nose, and it helps hold it up, sort of like a breathe right strip. If you guys heard of breathe right strips, it's like a little strip that you put inside your nose here. It's like a sticker and it holds it up. This is more like a permanent one that you put into your nose and it just stays there for about a year or two, and it dissolves actually after 2 years. And so if you see in this patient here, when they breathe in, the most narrow area where the air passes is actually right here, right below the roof of the nose. And so when the patient breathes in, you see the roof collapses when the patient is breathing in. When that roof collapses, then the opening of the nose becomes a lot smaller. When that becomes a lot smaller, then you feel your nose is congested because it's harder to pass air through a smaller hole. And so what you do is you can place this implant directly between the bone and the skin. See, as it comes out here, you see the implant is deployed, comes out, and it stays there, and it holds up the roof of your nose. It's extra support. When you place that there, now that when the patient breathes in, now the patient's breathing in, the roof does not move. When the roof does not move, it keeps this opening of their nose open. When it keeps it open, then you feel like you can breathe better because now you have a bigger passageway for air to pass through your nose. Okay, the third type of in-office procedure is called Turbinate Coblation. And so this procedure is meant for patients who inside their nose, they have a very swollen inferior turbinate. It's that little like sausage-like structure that comes off the side of your nose. And what we can do is we can actually shrink the size of that turbinate to make it much smaller, so it takes up less room inside of your nose, which gives it more room for air to flow from your nose into your throat. And so if you look at this patient here, his inferior turbinate is taking up almost the entire space inside his nose. And so what you can do is you can place this needle into this turbinate here. And what it's going to do, it's going to shrink it, make it smaller. It's sort of like liposuction for your turbinate. It doesn't make any cuts on the outside. It's really just suctioning out the inside of it to make it skinnier. So it uses a technology called coblation technology, which basically sort of melts away the fatty inside of this turbinate. So as it comes out, you're going to see how it looks from the outside. So now they're going to enter in this area here. And what you can see is, you see the size of this, it's going to start to shrink. It's going to enter first, and then it's going to shrink. So it starts to shrink now. When it shrinks, this space here, which air flows through to your throat, is going to become much wider. It becomes much wider, then you're going to have that sensation that you can breathe better because you have more room to breathe now. Okay? And he's going to do one more up here, and you keep shrinking it. And so the only way you can identify whether or not this is large enough is if you have a good exam. And so nasal endoscopy, I think, is very important to identify, is this structure actually very swollen? Because if it is, then you may be a candidate for this type of procedure to improve your symptoms. The last in-office procedure I want to talk about is called the Vare. And so this is a procedure for widening the opening of your nose. Well, some people, you look at their opening of their nose, it's very wide open like this. But some people, it's very sort of thick or very narrow. And so they have a very thick skin on the bottom of their roof of their nose, or they have a very thick middle, like a septum, thick septum in the middle of your nose. And so the opening into their nose is actually very narrow. And so you can use this device here. It has uses sort of heat cooling technology. It basically heats it at 60 degrees Celsius, which is the exact temperature that can reshape this area without damaging it. It helps thin out the walls of your nose to make it more open. And so if you look at this picture here, you see it's very thick here on the inside of their nose. And so you can use this to sort of shrink this area and widen the opening of their nose so that air can flow more freely into your nose and into your throat. And so this just came out about 6 months ago, but it's a very popular procedure for those that have this type of physical exam finding in their nose. But sometimes the problem that's causing your nasal congestion cannot be fixed with sprays, cannot be fixed with oral medications, and cannot be fixed with those in-office procedures. Sometimes the only way to improve your nasal congestion is to do surgery. So some examples I want to talk about is septoplasty and endoscopic sinus surgery. So septoplasty is done when the bone or cartilage in the middle of your nose is very crooked. And so you see in this patient here, the middle of their nose is an S shape. It's very crooked, which causes the spaces for air to flow within their nose to be very narrow. And if you straighten this and make it more straight, like in this picture, that opens up the passageways here for air to flow. And so that procedure is called a septoplasty. And so what that involves is we make a small little cut on the inside of your nose, not on the outside. As you can see here, we're going to look inside her nose first. So as you look at the cross section here, you see that her nose is very crooked to one side. And so because it's so crooked on that side, this patient's going to have nasal congestion specifically on this side here. So what you can do is you can make a small incision here on the inside of the nose, and then you remove the bone or cartilage that's crooked on the inside of the nose, and you take it out. It doesn't change the shape of your nose or anything on the outside. It just takes out the crooked part on the inside that's causing your nasal congestion. Once you take that out, it causes your nose to be straight again. And when it's straight, it increases the area where your air can flow inside your nose. And so then your nasal congestion will improve. The surgery that we can also do inside the nose is called endoscopic sinus surgery. This is usually for patients that have something inside their nose that has to be removed in order to breathe better. And usually this surgery is done for patients with nasal polyps. So nasal polyps are little growths inside of your nose that are more common in patients with asthma or who are allergic to aspirin, but that's not always the case. Some patients who don't have asthma or not allergic to aspirin can also develop these. But these things can grow inside your nose, and then they cause the normal passageways for air to flow to become blocked by these things. And so the way the surgery works is we use the nasal endoscope, which has a little camera on it. We go into the nose and we remove specifically just those things that are blocking inside your nose. And so the advantages of endoscopic sinus surgery are that there's no incisions on the face. You go directly into the nose through the opening, so there's no scars that you'll have. The entire surgery is performed just through the opening of your nose. And usually you go home the same day after surgery. It takes about 1 hour to 3 hours, depending on how extensive the surgery you need. And patients do very well. I'd say about half the patients don't have to take any pain medication after this type of surgery. And it's very precise because you're using a very small camera. So the patient's lying here, the surgeon stands on this side, and we use a TV monitor with that can see with the camera into the nose. And we can see exactly what we have to remove to help open the passageways for the patient to breathe in the operating room. And so in this patient here, you'll see that this patient has nasal polyps inside their nose. So when we look inside, you see there's a polyp here. It's sort of hanging down from the ceiling. This is the middle of your nose. This is the side of your nose. This is your middle turbinate. And so with the camera, we can see it, and then we use a small little blade to help remove just the polyp that's blocking your ability to breathe inside the nose of this patient. So now it's just going to remove this polyp here. When we remove that, now this space opens up so that air can flow. And there's one more here, another polyp here that has to be removed. And that opens it up, your nose again, so that you can breathe. So in summary, nasal congestion can be caused by many different things. It can cause by infection, swelling, or blockage inside your nose. And so it's really important to do a very good history and have your doctor look inside your nose, and if they can, do an endoscopy to really look at what is it exactly that's causing your nasal congestion. And by doing that, we can determine what type of treatment option works best for you. Because sometimes nasal sprays are the best option, sometimes pills, sometimes you have to do an office procedure might be beneficial for you, but sometimes you have to have surgery in order to get better. And so all that information is very important for the physician to determine what is it exactly that's causing your nasal congestion. And like I said, there's several options available these days, and it makes it easy for the patient. Not all of it has to be surgery in the operating room. A lot of it can actually be done in the office these days, depending on what is it exactly that's causing the nasal congestion. So that was a lot of information. Just so all you guys know, I practice at USC, and my office is actually in Arcadia.